Hello and welcome back. My name is Whitney, and I am a medicine intern documenting my journey as I go through my anesthesia residency. In today's video, I am here to report that I survived my first week of patient care in residency. So let's get into what that actually looked like and how many hours I worked this week. So, in this past week, I did something called continuity clinic, which is outpatient, meaning outside of the hospital, internal medicine. So, what this really comes down to is I was just doing primary care appointments throughout the week. This week was actually pretty easy hours wise, just because, when you're working in primary care, it's very predictable Monday through Friday, 8 to 5. And on top of that, it was actually a holiday this week, so we got a couple extra days off. So it really was a pretty light week, which I'm not expecting to be the norm for the rest of the year. I'll be doing a few of these continuity clinics throughout the rest of the year, which is honestly pretty nice because they tend to be lighter in hours and more predictable just because of that set schedule. So it actually gives you a time to relax and catch up with life, which will be really nice throughout the year. I think the only thing for me is I find primary care appointments to be actually pretty difficult. There's usually a lot going on and you have appointment time, so you have a very set amount of time to actually get everything done. And on top of that, I'm a brand new intern, so I'm pretty rusty with all of my skills. And it's a different hospital, so it's a system that I'm not at all familiar with. So there's just a lot going on, and I feel like I just need to keep doing this to actually get better at it. But for right now, I wouldn't say I'm very fast or efficient. But with that, I wouldn't say I'm the only one who's not fast or efficient. I think that's kind of known for when you're starting out residency that you're a little bit rusty on all your skills. Thankfully, I was paired with a senior resident for all of my appointments. So, someone with a little bit more experience was going in with me and talking with patients and helping me with orders and everything. And it was honestly pretty nice because it felt like someone was just holding my hand along the entire process, which I actually really appreciated. All right, so to go into the workflow of what it actually looks like to be working in a continuity clinic or primary care. So, the first thing that you'll do after the patient is done being checked in by the nurse or the MA is you'll actually just go in there and talk to the patient. So, you're going to use all the skills that you learned in medical school about gathering a history and figuring out why a patient is there and, talking to them about their concerns. And then you'll also do a physical exam just to make sure that they're looking healthy overall. So, you'll listen to their heart, lungs, press on their belly, do all of that stuff. Once you're done talking with the patient, you'll exit the room and you'll just take a couple seconds to gather your thoughts, organize what the patient had said, and figure out what you actually want to do for the patient. What this looked like for me, since I was working with a senior resident, is I was actually going through my plan with them before I staffed with the attending. So what exactly does that mean? So to start off with, a attending physician is kind of like the top of the hierarchy in terms of levels of physician. So they're the ones who have completed all of their training and they are working independently, so they're at the very top of the hierarchy. And when you staff with them, all that means is that you're actually talking to them about the patient, so you're relaying their history and telling them what you found about their physical exam. And when you're doing this, the attending physician is telling you what you think the patient's plan should be as well. So it's kind of like a two-way conversation about you suggesting what you think about the patient and then them giving you their suggestions, which is usually the final say, or I should say is the final say. And then once you're done talking with your attending physician, you go back and you tell the patient about everything that you talked about, and then you check them out and they can go on their way. At this point, usually you're putting in orders for the patient. So if they need to do any labs or any kind of follow up, you get that all coordinated for them as well. And then after that, you just work on your note and finish that up. And then it is rinse and repeat going on to the next patient. And you just do that for the rest of the day. In terms of the kind of problems that we see in primary care, this is obviously very chronic, not acute problems because you're not, working in the hospital. So we saw things like depression and anxiety, looking at high blood pressure or hypertension. talking about different lab values and coordinating patients going to specialists. So it's a lot going on. And it's just a very broad field and broad set of problems that you work with. But there's a lot of learning to be done in an area like that. All right, so now let's zoom out and see how many hours I actually worked this week. So I'll go ahead and post them up now. And you can see it was actually a pretty light week. We just had clinic Monday through Wednesday, and even Monday morning was like an orientation of some kind, so it like was really not intense at all. And then Thursday was a holiday, and we have Fridays off when we're on continuity clinic weeks. So I had a 4-day weekend, which was really nice. Even though it was pretty light hours wise at the clinic, I was still working on things outside of the clinic. So, like trying to figure out when I'm taking step 3, which is the board exam that you take during your intern year, and working on HR stuff for onboarding because I'm still working on that. So overall, not a lot going on. And I know that these weeks are going to be kind of far and few between where it's kind of lighter in terms of hours and workload. So I'm really just trying to enjoy it as best as I can before all the craziness starts. Speaking of crazy times starting, I will actually be starting what will probably be my hardest rotation of the year this upcoming Monday, so very soon. And the rotation I'm starting is called inpatient or working in the hospital internal medicine. So this just essentially just means like working with hospitalized patients. I actually really like hospital medicine. I think it's really interesting learning about all the problems and treatment options that you can do for patients who are acutely ill. It just can be really intense. And with this being my first time doing it during my intern year, I'm expecting it to be even a little bit more intense. So the reason I think this is because, I've worked with patients as a medical student in the hospital, but there's a huge jump in responsibility when you're working as a medical student versus when you're working as an intern or resident. So that's a huge jump that I'm going to have to prepare myself for. And also the fact that I'll be taking care of a lot more patients. So not only is there more responsibility, but there will be more people that I'm taking care of. So there's just a lot going on top of being just like new and not really familiar with the system. So I think Monday's actually going to be pretty rough. And I'm just preparing myself for that. And I'm telling myself that every day is just going to get a little bit easier, a little bit better. So I'm hoping the week just gets a little bit smoother as I go along. I think I also tell myself, that growth and learning can be really uncomfortable at times. And the only way that you actually get better at something is to do it. So I'm reminding myself of that, it's okay that I'm a little bit rusty right now. And if I really want to get good at these skills, I just need to do it. And even though I don't feel ready or prepared in any way, honestly, I just know that the only way that I'm going to get better at all of this stuff is to just do it. So I am pretty nervous about this week and how intense it's going to be, but I'm also just really excited to learn and actually get better at all these skills that I need to learn to be a doctor. All right, well, that wraps up this week's video. Thank you everyone for coming along as I document my journey throughout residency. I will see you all in a week when I have my first week of hospital medicine under my belt. Take care, everyone.